Hey everybody, welcome back to week 3 of our conversation regarding PCOS and Hirsutism. We're talking as hair removal experts about the treatment of PCOS today and really diving into what we typically see as medications our patients might be on, and two, how does that help us? And then how can we direct them towards the right type of testing and such to find out what is the best plan of action for them. So first and foremost, as a PCOS patient, it is incredibly difficult to find people who will actually understand and treat your symptoms, okay? There is no cure for this, which is a bummer at this time, but what we can say is there is treatment for this, and treatment is one of the things that's really gonna help them with managing symptoms. Now, when I think back to my own symptoms, I think back to the fact that I treated my hair before I knew it was a problem. I treated my weight because it wasn't regarding my PCOS. It was more regarding the mental component of it, right? I knew that was something that was bothering me mentally, so I took care of it that way. As for my acne, I was already doing skincare, so it's if I'm doing skincare, am I keeping it at bay? Am I there were little tidbits here and there. And the thing is a lot of us think that it can be fixed with a pill and we can go about our day and just cruise on by. But in many cases, the medications that are even given to a diagnosed PCOS patient don't necessarily always help those scenarios, because what they're doing is they're managing a symptom within what they're going through. So what we most often see on our EMR, our patient intake forms, is we'll see metformin, spironolactone, and birth control. And those are that's the trifecta of things that PCOS women patients get given all the time. And that's mainly because that's really all that allopathic medicine, traditional medicine, knows what to do with it, right? They're not really, in most cases, they're not going to put you through hormone replacement therapy, especially if you're a younger patient. They're not going to necessarily work with your symptoms outside of most of them are manageable in the eyes of medicine, and so they're just not going to dive into it. But the thing is when you look at that trifecta, that's not a good trifecta, okay? So metformin, yes, it's good because it helps manage insulin resistance, but there are medications and supplements that can do that without the massive side effects that you get with metformin, which can lead to gastrointestinal issues and just it can be hard to get for a PCOS patient that's not diabetic because it's not within the scope of practice, scope of treatment for that patient. Then spironolactone. Spiro is difficult for people to get because it is a blood pressure medication, and in many cases the doctors don't necessarily willingly give that away to a patient that doesn't have a blood pressure issue. And then birth control is one of those things, they'll willingly give out birth control, but they won't really manage the birth control treatment. So when they're given these medications and then told, okay, well, this is what you're taking, diet and exercise, and you're good to go, they don't give a path and a plan. And so one of the things as a practitioner that treats that patient is I'm always thinking about what's the plan, the path that I can give them, right? And so what I can do when they're on the table is I can talk to them, one, about hey, what are you having done when you have your test done? Who are you going to, and what are they doing for you, right? Are you finding that the medication regimen that you are on is helping your symptoms, right? Obviously, it's not going to take away the excess hair that we've already stimulated, right? That's why we come into play as a practitioner. But is it managing new growth? Are you seeing less onset of new hair growth? And then are you seeing it help regulate your cycle and still keep a cycle going? Or has it diminished it completely? Because as someone that needs to have the monthly cycle, right? It helps with managing your body's natural flow of estrogen in and out, right? And so those are important. Your progesterone levels, your estrogen levels, they're important because that's what your body is needing to do. But if you are under the age of, say, a menopausal individual, the chances of your doctor turning towards hormone replacement therapy is fairly low. And so that means that they may be more symptomatic than what birth control can do for them. And without proper treatment, they may be feeling like they're up against a wall. So in the comment section, I'm going to put frequently used labs for PCOS. There's also the Dutch test. The thing I like about the Dutch test, and I'm seeing more and more of out there, is that it's Dutch stands for dry urine test. And so what it is like, it's doing kind of a pregnancy style testing of your hormones throughout the day. You submit it to a lab and it comes back with what your body is doing with that flow of the hormones. So it's not your traditional blood test that your doctor might be doing kind of like generically. Excuse me. So as you're going through this, I would go for your blood work labs. I would test your glucose levels throughout this. I would test and see if the Dutch test is something that you can have access to, and get that where you can test your hormones kind of throughout the day and figure out what your body is currently doing. Because if you are only regulating from the trifecta, you're not really giving yourself a chance to dive into those other issues that we are facing as a PCOS patient. As a practitioner, if we're helping our patient guide them towards those answers, what they will find is better treatment for their body and better treatments on the table. Because the fact is this area here in the treatment room is only given more benefit once we find them, resources that can help their body regulate. So in the last little bit of this, I want to really talk about the fact that, like, in the previous video, I talked about different doctors that someone can go to for diagnosis of PCOS. But what do you do once you get that diagnosis, right? Because is that doctor then able to then help, and are they willing to dive into like the Q&A? Like, are they willing to like figure out how to manage the symptoms that patient's going through? Are they recommending out, there's a mental health component to this, there is sleep components to this, there is hormonal components to this, I could go on and on and on, and that's what the big lesson's about. But like, if their doctor that diagnosed them is unable to do that, then what we need to do is say, okay, remember that little like the boots to the ground, how we went out and we like talked to different practitioners in our area. Now it's time to give that resource list of like, hey, I recognize the fact that you went and got diagnosed here. You're not really getting help with your treatment. However, I do have these resources, and then help list them. Give them a comprehensive list so that they can go and feel less stress, which is like a huge help for someone with PCOS. Stress is something that we manage poorly in our bodies. So it gives them less stress and less being overwhelmed by like all of the options that they could possibly get, and they can keep narrowing down and figuring out if that doctor is the right fit for them. So yes, there are medications out there, and yes, they can help. I mean, like if you see a patient on spironolactone, what you're going to notice is that patient has the opportunity to have less new growth. But if that's not the right medication balance for that patient, then there's no point in them being on spironolactone, because the minute they go off of it, then we're going to see an influx of hair growth. So what I would do is I would really dive into your resource list, okay? Talk to doctors and just say like, hey, like I have patients who have been diagnosed, but they haven't been given an opportunity to find a practitioner that will treat the symptoms, right? And then from there, give that back to the patient, because the thing is you have time on the table where you can converse with them and you can be that resource center. Not necessarily, you're not a diagnosis center, but you are a place to say, okay, like I hear you saying this, and I was actually talking to a practitioner in this PCOS group, and at the end of the day, they, recommend doing this. I would look into this further. You can guide somebody to looking into resources further that will give them so much more than just like, hey, here's the trifecta and have a great day. So that's where it's all at. Next week, we're going to talk about electrolysis and laser regarding PCOS. And like, I'm going to talk about like how I do treatment regimens, and help you guys kind of figure out like, why do I say that I do both? When do I use them? And then we're going to figure out like what the best treatment plan is for the patient on the table. If you guys are electrologists, there is an upcoming lecture actually this Sunday. I don't know if they're still accepting new people to come and watch it online, but the Illinois Association of Electrology, or Electrology Association of Illinois, is having their spring seminar, and I will be speaking there regarding laser and electrolysis. It's different from obviously this conversation, but it's a good tool to have. So keep your eyes on my calendar online so you guys can see what upcoming lectures I'm going to be doing. And then 2 weeks from now, I'm speaking in California regarding electrolysis in your business and how to grow your treatment plans and practice together. So I hope you guys have a great day. Thanks again for coming by and having another conversation with this hair removal expert, because I like talking to the camera. Have a great day, guys. Bye. Oh, you are still here. That means that you haven't done the most important part about this video. Make sure to like the video, comment below, and hit subscribe so you can catch up on next week's video, just in case you miss the announcement. Talk to you guys soon.